Okay, our next chapter is chapter 37. It's urinary and reproductive. We're going to get this quickly. Um, Even though when I think of long-term care facilities, I always think of older people, but you do have some facilities that take younger people. So you might see some of these occur um, as far as reproductive disorders. But now everybody is susceptible to a UTI, and a UTI is a urinary tract infection, and it can involve one area or it can involve the entire kidney system. So common causes include catheterization, that's why we do cath care, urological exams, intercourse, poor perineal hygiene, especially wiping from back to front, immobility, and poor fluid intake. So women are greater risk, as I told you, because our urethras are basically just shorter than men's. Older persons are at high risk because they don't drink as well. They have not may not have their hygiene may not be as good, and they may have incomplete bladder emptying. Um, Incontinence really is a big problem here, especially fecal incontinence or and then their nutrition that may not be up to par. So that's what makes them at more risk. Cystitis is a bladder infection caused by a bacteria, and cystitis means that the long urethra there is inflamed. Okay, um, but anytime that you have a bacterial infection, the doctor's going to treat that with an antibiotic, and then we are going to encourage fluids. We want them to drink. So unless their fluid has some form of fluid restriction, we want to encourage our elderly persons to drink, especially if they have an infection. That's even more important. If it goes untreated, um, these infections will continue to travel upward. So it starts at the urethra, moves to the bladder, then from the bladder up the ureter to the kidney. And when it gets into the kidney and causes inflammation there, it's called pyelonephritis. Um, and infection is the most common cause of getting pyelonephritis. And again, it's more intensive treatment and usually a hospitalization with antibiotics and fluids for those persons. So we try to prevent that as much as possible. So again, for your UTIs, making sure women and men both wipe front to back and maintaining their perineal hygiene, maintaining hydration, drinking fluids, and assisting them to eat, making sure they're having proper nutrition helps all this keep UTIs down. Catheter care, can't stress that enough either. But BPH, or benign prostatic hyperplasia, means that, and this only happens to men because it happens in the prostate. And the prostate is this little donut thing that goes around the male's urethra, way up at the top near the bladder. And the prostate grows the entire lifetime of a man. So that's why you don't get BPH most of the time until they're older, because the prostate has grown larger and basically it's kind of squeezes off the urethra and they can't pee. Okay, it causes urinary retention. Um, Bladder function basically is gradually lost, and what happens is their urine stream starts to get weak, or they start voiding quite frequently, and it's just a small amount of urine, and they get urgency, or they dribble a little bit um, of urine, and they void frequently at night, and then they can have what's called urinary retention, which means they can't void at all. So that's why you can go in sometimes, or if you're wanting to ask a question, you can always ask them this. But as a nurse, I would go in and say, okay, is your stream good? Can you stop okay? Do you ever have any dribbling or leaking? And I always ask them how many times do they get up during the night to pee. And those are just important questions as a nurse. That's what I would ask them about their voiding habits. So if I get this from men where they're having difficulty, then I can pretty much guess that their prostates the problem. So again, you'd have to call the doctor. Um, they treat this BPH in different ways. They can use a medication, or they can do laser treatments, or they can do surgery. And basically, that's really all you need to know about BPH is that it can cause urinary retention. So if you start having some of your guys, you're noticing they use the urinals. Men will use the urinals. They're really good about it for the most part. And if they're using the urinals, and you start noticing some differences in the amounts, you can ask them questions or at least report it to the nurse so that she can ask the questions. A urostomy is a urinary diversion, and sometimes the bladder has to be removed surgically for cancer or some type of injury, and so we have to make a new pathway. So they call that a urinary diversion. And what it's called for is a urostomy because we all still have to pee, no matter whether our bladder can work or not. So it's surgically created, and what happens here is they're going to create a stoma, which means they're going to bring up the ureters outside the abdomen and turn them over basically and make what's called a stoma, and then the urine is going to drain out this way, and they put a pouch over it. So once you put the pouch over it, it's called a urostomy, and the urine is going to drain through the stoma into the pouch, and then hopefully it stays on really well, and the pouch is then only changed every 5 to 7 days. But basically they can leak. That's the big thing. So any you you have a person with the urostomy, you would want to check and make sure there's no leaking. So if you find something wet, then that needs to be reported so that the nurse can change it out, change the pouch out. A person can also get kidney stones, which is known as renal calculi. Uh, White men between 20 and 40 are at the greatest risk, or persons in bed rest, or they're immobile, or they have a poor fluid intake. A lot of times we have to give them meds for pain relief because they are very painful. We need these people to drink a lot of fluid, 2 to 3,000 milliliters of fluid a day. This is the people that we will strain the urine on, okay? And sometimes dietary changes help prevent them. As far as renal failure, all you have to know is that when a person's in renal failure, the kidneys are not functioning, okay? So that means waste products can't be removed from the blood. So the body retains that fluid. Okay. Now, sometimes people in renal failure don't pee. And then sometimes, even though they're in renal failure and they pee, but they're not getting rid of what they need. And it's usually not the adequate amount of fluid, adequate amount of pee, because usually we pee out what we drink in. So if I drink in 1,500 milliliters a day, I usually should be able to pee out 1,500 milliliters a day. So we have a balance, okay? Um, in kidney failure, since your kidneys aren't working, you don't have a balance. So everything you drink in is staying in, okay? So you're getting rid of little to nothing, especially the waste products. And, if we take drugs that are broken down, that's waste products that are floating in there. Um, so kidney failure can be acute or it can be chronic. And if we retain, again, that second line about heart failure and hypertension, that's just because we have extra fluid, in which is not good. So renal failure is a serious thing. If it's acute renal failure, sometimes it can be reversed depending on what caused it. If it's chronic renal failure, um, they might end up on dialysis basically. But they usually are also restricted in their fluids, and their diets are special as well. Um, let's see, we'll read over this one. Basically, chronic renal failure can cause hypertension, diabetes, infections, urinary tract obstructions, and tumors. And basically, there's nothing, a thing you can do. This is just for your information. Um, and basically, we have to treat these people with a little more special care because they're more fragile, basically. They're at more risk. As far as reproductive system disorders, um, that's pretty simple. About males, they produce sperm, females produces eggs. Both um, sexes produce different types. We produce all the hormones for each of us, but the levels at which we produce them are different. And of course, aging and injuries and disease all can affect the reproductive system. And that's really all you got to know about reproductive. As far as pelvic organ prolapse, uh, when the bladder drops down into the vaginal canal, it's called a cystocele, which for the most part you probably won't see, but you can get the complaints. Like the person can, uh, oh, what do I want to? How do I want to say that? Let's see. How do I want to say that? Well, they will start to have problems. They'll feel pressure. Um, they're not peeing adequately. Um, if it happens to fall back towards the rectum, it's called a rectocele. Again, they'll have trouble. They won't be able to poop well, or they still feel like they're not emptying well. That type of thing. They still feel like they got to poo even though they've already been. And if the uterus shifts forward into the vaginal canal, it's called a uterine prolapse. And this is where basically it drops down into the vaginal canal. Now, you can see uterine prolapse, and you probably could see a cystocele, but there's always a possibility. But you probably won't know what you're looking at anyway. So the main thing is, if you see something down there that's not really supposed to be there or that looks abnormal, then report it. Okay. Um, the other thing on here that I really would like for you to know about that you might be involved with is the pessary. Uh, the pessary is like it's a support, but it's a supportive device. And what is it? It's like a firm. Think of it this way: it's like a firm tampon that fits up into the vaginal canal and supports the bladder. Okay, it's going to push the bladder and the it supports the uterus and the bladder. It pushes the bladder up where it should be so that the person can empty their bladder better. And it has to be taken out and washed off, basically. So if the person can't do it and uses a pessary, guess who's going to be doing it? And basically, soap water, drying it thoroughly, rinsing it thoroughly, and then drying it, um, and giving it back to, and put um, giving it back to the person either for placement, or the nurse can help with the placement, because you put it in just like a tampon. And but it's called a pessary. Okay, pessaries have been around for a long time, and basically I've only had one person use a pessary. She didn't like it, so she didn't use it very often, but every once in a while she would. She'd put it in, but I didn't have to do anything for her. The aide didn't have to do anything for her. She could do it herself. Then you have a sexually transmitted disease. They're spread by oral, vaginal, or anal sex, use of condoms, that type of thing. If you see anything downstairs that's not supposed to be there, or that looks unusual, or, that's why we wear gloves. So we're not touching things that we shouldn't be touching, or transmitting something from somebody else or to ourselves through touching the perineal, these areas, without gloves on. So really, wear your gloves. Um, but you can also have, since as human beings we can have oral or anal sex, you might have other abnormalities at the ears, the mouth, the nipples, the tongue, eyes, and nose. So if you see something there that's not supposed to be there, or you think it's unusual or it shouldn't be there, then report it. And again, follow your standard precautions and blood pathogen standards. Um, and you can read over that. We're at the end of this chapter.